May is Stroke Awareness Month, and while strokes can be, scary and intimidating, there are things that you can do preventative measures that you can take, and things like be fast to know. I am joined by Dr. Pusey here at Lexington Medical Center. Thank you for joining us today.
Well, thanks for being with us. Thank you.
Yeah, absolutely. First, I want to know a little bit of background about you as a doctor. How long have you been in the field? How long have you been here?
I've been in business quite a while. I went to the College of Charleston and Medical University of South Carolina, where I graduated in '81. Finished up neurology training in '89, and I've been in private practice for a while. I've been in this hospital as a neurohospitalist for about 5 years.
Okay. The warning for strokes, it's be fast. It was originally just fast, right? And then it's recently expanded.
We've expanded it because we want to have our patients know what to look for,
right?
So they'll be forearmed, forewarned in case it happens.
Yeah, talk me through the be fast.
Well, the be fast is an acronym starting with B, meaning balance. Whether you're off balance or you're stumbling around or you have vertigo that's unexplained.
Okay.
The E is for eyes. Did you lose vision? You can't see things on one side or the other. The F is for face, whether you have weakness on one side of the face or the other, or started drooling. The A is for arm. Do you have any weakness in an arm or leg? The S is for speech. Are you slurring your speech, or you're understanding what people are saying? And then T is time. Time to get to the emergency room, time to call 911.
And time is a really important factor for strokes, right? Because the medication administered, there's kind of a time limit on that.
Very much so. We say time is brain. The sooner you can get to the emergency room, the more options that we have. The first option is to try to use a clot dissolving drug. What we use is TNK. But we have to give that drug within the first 4.5 hours of when the patient was last known to be normal.
Wow.
After that, it becomes more dangerous and less effective.
Okay.
After that 4-hour period, we also have the opportunity, on occasion, if we see a clot in the brain, to take a catheter and either pull it out or suck it out.
Wow.
That time frame is up to about 23 hours. However, again, the longer you wait, the less effective it is and the more chance of disability you may have going forward.
Okay, yeah, so if a family member, friend, community member even, you see someone showing some of these signs, what's the quickest way to kind of get to the hospital?
Well, the main thing is, again, time, and that means call 911. Yeah. Don't try to take your own car. Don't try stopping off at an urgent care. If it is a stroke, activate 911. They'll come and get bells and whistles and get you here as quickly as possible.
If they miss that 4.5-hour window, then they can move into maybe that 23-hour window. Is there other options after that?
After that, it's a matter of picking up the pieces.
Okay.
Rehabilitation and secondary prevention. Why did the stroke occur? What can we do to try to prevent the next stroke from occurring?
Yeah, absolutely. Speaking of preventing stroke, what kind of things, even people who have never experienced stroke, healthy people, what can they be doing to prevent strokes in the future?
Well, the first thing is a healthy lifestyle. We want patients to eat right. Good sleep, good oral hygiene actually can help lower the risk for stroke.
Wow.
And then the major medical risk factors for stroke: high blood pressure, diabetes, cholesterol. Also, we don't want patients smoking, and we don't want patients drinking to excess.
So really just taking good care of your body, really what it comes down to.
Absolutely.
Absolutely. Well, thank you so much, Doctor, for chatting with us about this today, especially during this month. Super, super important to know the signs and know what to do. So we appreciate you. Thank you.
And thank you for being with us.
Absolutely.
Thank you.